demonstration of cord gas collection. You're going to grab 2 of these Provent arterial blood sampling kits and open those up on the table. You'll have a cup of ice ready, a biohazard bag, labels ready stating one is arterial, one is venous for both samples. And you also want to include the collection time of your draw. So these are pre-heparinized syringes. What we're going to do is just take the cap off. You're going to expel, take the cap off, and then you're going to expel any additional air that's left in the syringe. When you're drawing your samples, you want to try to do your arterial first, which is the smaller vessel that runs in the vein. You can see it there. The larger, much larger one is the vein. Arterial is going to give you a more accurate sample. There again is another view of the 2 vessels together, arterial and venous. So you are going to go in just as you would any other draw, without your fingers in the way. Just go in slightly. And you are going to gently retract your sample, being sure not to go through to venous. If while you're drawing your sample, the blood stops coming, be patient, pause, wait a minute for it to fill back up, and then continue to draw. Once you've collected your sample, you want to get at least 0.3, but the goal is a full ml. Safety cap. And expelling any excess air. Going to your filter cap. And you're going to go right down until that is full. So that's what it should look like. Label her up, put it on ice, and proceed to venous. Removing the cap, expelling anything in the syringe, entering the vessel, drawing back, and again, this is, well, I guess we'll get one in a little bit in here. So idea is you want to draw slowly. Drawing your venous first can actually cause things to collapse, making it difficult for you to find your arterial. So just remember to do the arterial first. So when you've collected an adequate sample, I don't know if that's still going or not. I think it is. We're going to pretend that this is filled all the way up, but we have a pretty good sample here. So again, the goal is 1 ml, minimum is 0.3. Remove your needle, safety cap, and expelling any excess air. Going to your filter cap, and you're going to go right down until that is full. So that's what it should look like. Label her up, put it on ice, place in a biohazard bag. Probably should have got a smaller cup. And this should be transported to the lab immediately after being drawn. And that's it. If you have a question of whether you have gotten both the arterial and the venous samples, you can note that the arterial blood that is collected is usually darker in color than your venous sample. So that's a good reference to know that you didn't inadvertently puncture the vein and draw the arterial sample from the vein.